I think that's so important, and I've experienced that personally with my own pregnancies, and even not even just with racism, but what I would call just prejudice, and the fact that I was in my 20s when I first started having kids, and I was considered to be fit. So you can't possibly have any underlying issues. You can't possibly have any problems with your pregnancies. Well, I did. Even though I fit the prototype of what a normal, healthy young woman looked like, I still nearly lost my life having children because I had issues that weren't addressed.
And that's why this dialogue is so important, because when you look at the data, it's not a direct correlation. It's not about education. It's not about income. The one factor that continues to be consistent is skin color, right? And so I'm just glad that you raised that, because many folks think that because you have more income or privilege, or you have a better paying job, or you have better health care, that would change the outcome. But what we're seeing time and time again, especially when it comes to Black maternal numbers and Black infant deaths, it doesn't matter what zip code you come from or what your background is, that this is something that is an epidemic in our community that has to be addressed, and there has to be national conversations, state conversations, and dialogues like we're having today to shed light on it.
Well, and then sometimes it's not just the care you're receiving, right? We know, and we have data to support it nationally as well as locally, that women of color, particularly African American women, are more likely to have a miscarriage. And so it has an early miscarriage. So it has nothing to do with, the poor medical care or the discriminatory medical care that you may or may not have received. It's just our bodies. And our bodies as women of color, no matter what our income, no matter what our title is, have had a great deal of stress that has come onto us just because being a woman of color. And that unfortunately can exacerbate our ability to carry a baby to full term. And we've seen that. And we have seen, Harvard educated women, well paid, great insurance, miscarry at 10 weeks, at 15 weeks, at 20 weeks. And it really is just this long-standing stress that they've had on their body. And they've had studies that shown, their cortisol levels are up, all of their stress reactors are up compared to women of their same age and same neighborhood.
Well, and I'd like to add to that as well that one of the things that I see is that we're talking about racism, and we're talking about medical racism as something that exists. And we're also talking about multiple systems. So families who are pregnant are experiencing systems that are not just medical. They're experiencing, judicial systems, housing systems, the job. They're experiencing all sorts of systems. And inside of each one of those, racism shows up differently. And so what you wind up needing for a person to have a successful birth is for all of these to align. And that's why the coordination of all of these different systems is so important, because you experience stress from your work environment, you experience medical racism, you might have housing issues and be more inclined to be evicted based on your skin color, and you're experiencing them all at the same time. And so our responsibility as workers in this field and as advocates is to force alignment and to find that racism and the way that it shows up across all of the systems that our families encounter, root it out, and align us to a place that has an environment that's healthy for families to develop.
Well, and I would also say, Director Tong, that our role, particularly yours and mine, is to provide, that wraparound service, and so that the patient, the client, doesn't have to navigate the system alone. So that's why we have case managers, that's why we have navigators to help them, because it can be challenging to figure out, to know where to go, to know what you need, to know what office you show up at, to know what form you fill out, how do you get this bus pass, how do you do this? And so we have, given that responsibility to ourselves to help pregnant women here in Columbus and Franklin County try to navigate that system, because many women and families in our community need that extra support. And so it's not only, recognizing that there's multiple players that individuals have to work with, but how can we streamline that process for them?
I also think Celebrate One has a responsibility in addition to that to support that alignment. So we have community health workers that work with Celebrate One, and we help families navigate the systems that we just talked about. But we also have a responsibility to helping support in the housing area as well. We have a responsibility to helping folks navigate their workforce development, which we see a lot in housing as a compounding issue. And so for us, getting to that social determinant, getting to those social determinants of health is an equal part of supporting the person through what is largely a system that is stacked against them, and helping to create a system that works for all people.
You gotta jump in. You gotta jump in. You gotta jump in.
Well, I love the passion, and I love that each of you have something to contribute that's impactful and important to say.
So the educator in me wants to clarify. I think when we talk about medical racism, people automatically assume that that means my doctor is racist or my nurse is racist. It's a system that we're talking about. We're talking about an entire medical system that was built on racism. We can't scurry away from that fact. It is what it is. And we have to talk about how healthcare systems, specifically the 4 in Central Ohio, take accountability for that. When we think about health equity and the DEI departments in hospitals, what are these departments doing to ensure that our health equity plans are tangible, that they name names and responsible parties for the work that needs to be done, and then actually go ahead and tackle that work? The accountability is everything, because if we're continuing to talk about it and we're not taking the action, we're not going to go anywhere.
And I think the problem is that, many of these words that we're using have become boogie words
Buzzwords.
Once again, right? They're buzzwords that have been weaponized to really diminish the impact of what we all know to be true. And the reality is that we cannot operate in this idealistic society, post-racial, thinking that these things don't matter anymore. I don't see skin color. The proof is in the pudding, right? The 5 of us would not be sitting on these couches right now had we not personally experienced this, had we not had family members that have encountered this, that the data did not reflect, not just in the city of Columbus, but in the state of Ohio, that this is a problem that requires not just legislators, but we need scientists, and we need doctors and nurses, and we need folks with dollars and people who care about the livelihood of this state and this city and this country to pay attention to what's happening to Black families.
And I know we've talked about medical racism, we've talked about racism, we've talked about empowering individuals when they're at healthcare, but I would also say I don't want people to hear this or listen to this and think, well, the issues are so far above me that there's nothing I can do as an individual, whether I'm thinking about getting pregnant, whether I'm a soon-to-be grandmother. I would say what we need to do, particularly people of color, particularly Black people, because we do this well, is we need to talk. And that is something I think we don't talk enough about. We don't share our stories. So, Jennifer, I really appreciate you sharing your story, because I know it touched a lot of families by you being honest with your experience. But I think all of us need to do that, whether it's maternal health issues, or infant health issues, or any other issues. We need to share our stories, because people learn from others. That's how we learn. That's how we in the Black community learn, And so we need to be open and transparent, when appropriate, about our stories, so that others hopefully don't have to go through that same thing. And if they do, they know that they have someone there who can support them and guide them and tell them their experience.
And the hope is that those conversations don't start at age 40, right?
Correct.
That we are having these conversations early enough that folks can catch when problems are starting to perk up, and that we can connect them to whatever resources they need to mitigate whatever it is, so that they can live out whatever their dream is, whether it's to have a family or just to live a great solo life, right? But the reality is that we don't talk enough in our community, especially about the hard things, about the personal things, and these issues are deeply personal, right? But we are in this work of public service to make sure that not one other person has to live our story or have the same experience as us, that they can have a better experience and go on to do whatever they would like to do in this lifetime.
So
Absolutely.
thank you for first catalyzing this conversation, for getting us here to talk
Well,
about
I'm
this.
so appreciative to you all for agreeing to that. And actually, that's exactly where I was going to say, I could keep you here all day and just talk about this because it is that important. But you're right, we have to talk. And that's what this conversation and the grander conversation is all about. Talking about the really hard stuff, but giving you that door, kind of saying, here's how you can start. And it doesn't have to be long and drawn out. It doesn't have to be a series of conversations. It just starts by starting. Just speak to someone about these really tough issues, because we're not going to see that big change until it starts, like you said, on the ground level. And if we can start here and over the next few years, hopefully see some big changes for our community, then I think we've done our jobs and hopefully have made a big difference for the people where we live. So thank you all so much for being here and for being part of this. And I think we're going to have some more in-depth, maybe more personal one-on-one conversations down the road, because people do need to hear our stories.
They do.
They need to know that our story may be what their story is, or vice versa, and that they're not alone in this. So I really appreciate all of you being here and sharing with me today.
Thank you.
Thank you.
Thanks for having us.